नमस्कार दोस्तों, मैं आपकी होस्ट शिप्रा इब्राहिम आपका डिजिटल इंडिया आस्क आवर एक्सपर्ट्स के 47वें एपिसोड में बहुत बहुत स्वागत करती हूँ। आज का एपिसोड कैंसर और एआई के मेल जोल से रिलेटेड है। iOncology.ai is an AI-driven platform designed to support oncology research, diagnosis, and treatment planning. Let's watch a video around it.
The Center for Development of Advanced Computing, C-DAC, is India's premier research and development organization under the Ministry of Electronics and Information Technology. Every day, you step onto the front lines of the most difficult battles. You face an overwhelming patient load, scattered clinical data, and the ticking clock. You are the beacon of hope for thousands. But the sheer volume of information can be a barrier between you and the patient sitting across from you. You need more than just data. You need a partner. You need the power to make precision decisions instantly. Enter iOncology.ai, an India-centric, integrated oncology platform, custom built for the challenges of our healthcare system. We aren't just bringing you software. We are bringing you the world's 75th fastest supercomputer, IRAWatt, right to your clinic. This is a robust AI pipeline, fortified by state-of-the-art deep learning infrastructure, designed specifically to be your ultimate virtual assistant. From risk screening to timely diagnosis, prognosis, and treatment assessment, iOncology.ai is with you at every step. Struggling with complex cases? Our integrated models handle CTs, ultrasounds, mammograms, and histopathology with pinpoint accuracy. Need to seamlessly access records? We are fully integrated with the Ayushman Bharat Digital Mission, bringing clinical data, radiology, and omics data into one unified, secure dashboard with role-based access. What does this mean for your practice? It means faster, evidence-based diagnoses. It means reducing treatment delays and minimizing misdiagnoses. It means leveraging India-specific medical datasets to craft personalized, precision treatment plans for breast and ovarian cancers. But most importantly, it means buying back your time. Time to focus on what AI can never replace: your intuition, your empathy, and your connection with your patients. Medicine is a science, but healing is an art. iOncology.ai gives you the ultimate scientific tools so you can focus on the art of hope. Join the future of precision medicine today. iOncology.ai, powered by HPC AI.
थैंक यू फॉर द वीडियो। दोस्तों, जैसे जैसे दुनिया भर में कैंसर के केसेस बढ़ रहे हैं, वैसे वैसे टेक्नोलॉजी हमारे मेडिकल प्रोफेशनल्स के लिए बहुत मददगार हो रही है। कैसे? आइए जानते हैं अपने पैनल से। टुडे वी हैव अ वेरी एस्टीम्ड पैनल विद अस who will explain this and solve all our queries. I welcome to the show Dr. Professor Ashok Sharma, Department of Biochemistry and Professor in Charge, Neurobiochemistry, AIIMS, New Delhi. Lakshmi Panat, Program Director, AI and Quantum Technology Group and Technology Director for AI, C-DAC. And Dr. Fauzia Siraj, Scientist E in HOD Pathology, ICMR, Center for Cancer Pathology, New Delhi. I welcome you all to the show.
Thank you.
So दोस्तों, जैसा कि आप सब जानते हैं, हमारे शो की शोभा आप ही के सवाल बनाते हैं। सो आपका ब्रेस्ट कैंसर, ओवेरियन कैंसर या iOncology.ai प्लेटफॉर्म से रिलेटेड कोई भी क्वेरीज हों, आज के शो में सुनने के दौरान आपके मन में कोई भी सवाल आते हों, तो कृपया अपने क्वेश्चंस को हमारे YouTube लाइव के चैट में लिखिए। मैं पूरी कोशिश करूंगी कि मैं आपके सब सवालों का जवाब आज अपने एक्सपर्ट से इस शो में ले पाऊं। मैं आप लोगों को एक और बात बताना चाहूँगी कि हमारा आज का शो विल बी बायलिंगुअल, दैट इज बोथ इन इंग्लिश एंड हिंदी, सो दैट most major part of the society, it can reach out to main people, everybody across the country. I'll also like to remind you that one of you, three of you will be our Digital India Question Ninjas. सो आपके सवाल ही आपको डिजिटल इंडिया क्वेश्चन निंजा का रिवॉर्ड भी दिलवा सकते हैं, तो कृपया अपने सवालों को लिखने से चूकिए नहीं, और मैं अपने डिजिटल इंडिया क्वेश्चन निंजाज का जो नाम है शो के अंत में अनाउंस करूंगी। तो आइए हम अपने सवाल हमारे एक्सपर्ट्स के साथ शुरू करते हैं। प्रोफेसर शर्मा, मैं पहला सवाल आपसे लेना चाहूँगी। इंडिया में कैंसर केसेस तेज़ी से बढ़ रहे हैं, क्या कारण है कि मरीज आज भी एडवांस स्टेजेस में ही हॉस्पिटल पहुँचता है?
शिप्रा जी, आपको और आपके सभी दर्शकों को बहुत बहुत नमस्कार।
थैंक यू सर।
जैसे कि आपने बताया कि नंबर ऑफ कैंसर पेशेंट हमारी कंट्री में बढ़ रहे हैं, आप बिल्कुल सच कह रहे हैं, क्योंकि एक तो हमारी कंट्री में जो पॉपुलेशन साइज है वर्ल्ड में एज यू नो नंबर 1 हो गए हैं। अगर हम स्टैटिस्टिक डेटा देखें तो यूएसए के कंपेयर में वी हैव हाफ। यूएस में 500 इंसिडेंट्स ऑफ द कैंसर 500 पर मिलियन है, जबकि हमारी कंट्री में अराउंड 250 पर मिलियन है। और हमारी कंट्री में अगर आप डेटा देखोगे नॉर्थ ईस्ट से लेके साउथ की तरफ, नॉर्थ ईस्ट में अराउंड 249 पर मिलियन, और महाराष्ट्र में आप जाओगे बारसी डिस्ट्रिक्ट में 50 पर मिलियन। तो हमारी कंट्री में इतना डिफरेंस है इंसिडेंस का। तो नंबर ऑफ कैंसर एज कंपेयर टू वेस्टर्न कंट्री, इंसिडेंस इज लेस, बट ड्यू टू द पॉपुलेशन साइज नंबर ऑफ पेशेंट इज वेरी हाई। और इसके लिए जो हम कह सकते हैं कि एक तो लोगों में अवेयरनेस की बहुत ज़्यादा कमी है, लोग जागरूक नहीं है इस बीमारी के लिए। दूसरा एक स्टिग्मा, डरते हैं, जैसे कि हमको साल में एक बार ही अपना ब्लड टेस्ट कराना ही चाहिए और डॉक्टर की राय लेनी चाहिए। अगर इन सब फैक्टर्स पे हम ध्यान दें तो हम कैंसर जैसी बीमारी से मिलके लड़ाई कर सकते हैं।
जी, थैंक यू प्रोफेसर। Dr. Fawzia, I'll come to you. Could you explain what role pathology plays in cancer detection and treatment?
Thank you very much for having us here today. So, pathology is the cornerstone of any cancer treatment and management. When the surgeon or the physician, when he suspects a cancer and he sends a biopsy to the lab to ensure whether it is, and confirm whether it is cancer or it's not cancer, right. It's only after the tissue diagnosis that the final report is given. That's why we say it's the gold standard for diagnosis. And pathology is not just saying that it is cancer or it is not cancer. There are multiple aspects to it. Okay. You have to determine what is the type of cancer, what is the grade of cancer, what is the stage of cancer. Right. And on this depends the future management and treatment of the patient. Now, with the advent of the era of new technologies and molecular pathology and other ancillary techniques, it's not just restricted to microscopy and just giving a diagnosis. Yeah. It's also kind of a precision report which is given. Right. You decide that what kind of treatment, what kind of markers you put on those cancers, so that the future management or treatment of the patient can be decided. So that also becomes a very important factor by pathological diagnosis.
So ma'am, you mentioned about the latest technologies. अगर हम traditionally बात करें तो how difficult it used to be to and time consuming and complex it used to be to detect cancer and all this diagnosis through pathology.
So what used to happen earlier was that in conventional pathology, the tissue would come, and it's not that you put the tissue directly on the microscope and view it. Okay. You have to go through a process which has precise timings. For each step there is a precise time. And so it takes roughly around 3 to 5 days for the basic report to come from the tissue till the slide preparation and the initial preliminary report of the pathologist. Okay. But then, if you, as I said, I'll give you an example of breast cancer. Okay, we have diagnosed it as breast cancer. But now, in this era, we need to know whether it is luminal A or luminal B based on molecular markers.
Okay.
So we have to put those additional tests also on. That will take extra time. So it depends from lab to lab and from what kind of infrastructure you have available, how much time it takes. But conventionally, for an initial report, it takes around 3 to 5. But with the advent of newer technologies, the timing may increase. But now we have additional modalities which decrease the new technologies, in which AI is definitely set to play a role.
थैंक यू मैम। लक्ष्मी मैम, मैं आपसे पूछना चाहूँगी कि हमें एज अ कंट्री, एज C-DAC को कैसे फील हुआ कि अब AI और टेक्नोलॉजी की ज़रूरत है कैंसर डायग्नोसिस में?
Sure. Thank you, madam, for having us on the show today.
मोस्ट वेलकम।
So actually, Dr. Sharma as well as Dr. Fauzia, they have set the stage for the importance of AI in this field. So एक पहली बात जो डॉक्टर शर्मा ने कही कि इसका जो व्याप्ति है वो अक्रॉस द कंट्री बहुत अलग अलग है. सो डेमोग्राफिक चेंज एंड types of cancer also very varied, and like she said also that the technologies that are being used are also very varied even within pathology, and the other area we are targeting is radiology. So definitely the time is very ripe for using AI as a solution. AI stands typically on 4 pillars. First pillar is that of infrastructure. So C-DAC has this large Eravat infrastructure. So that powers the technology that AI requires to create models. The second part is, like she said, there is a lot of data that is available today. So the heart of any AI system is the data that is required. The third is, very importantly, inspired doctors. So we have 2 doctors amongst us today.
Yes.
The fourth is AI experts. So we have a very good mixture of these 4 fundamental pillars. So this is definitely the right time for solutions, AI-driven solutions for oncology. And like our PM says, yahi samay hai, sahi samay hai. So definitely this is the right way to go today.
थैंक यू मैम। डॉक्टर फौजिया, आपने टाइम के बारे में बात करी थी कि टाइम बहुत इम्पोर्टेंट है। सो व्हाई इज अर्ली डिटेक्शन सो क्रिटिकल?
Early detection is extremely important in cancers. 3 पहलू हैं इसके. One, एक clinician के aspect से कि if he picks up the cancer immediately, so he is able to treat that particular cancer in a manner which may not be as aggressive as it would be had it been detected late. So उसकी जो ट्रीटमेंट की स्ट्रैटेजी होती है वो वैसे ही फॉर्मुलेट होती है. पेशेंट के एंगल से अगर हम देखें, विच इज़ द मोस्ट इम्पॉर्टेंट थिंग, as long as the cancer is detected early, so the treatment is also limited. Generally, in most of the cases, it is limited. I'll give an example of a breast lump. If a lady presents with a breast lump, if it is small, she need not to have her whole breast removed. Only a part of a lumpectomy can be done, a part of breast can be removed. Vis-a-vis, if it's detected late, then the entire breast may need to be removed. And then there is another thing, cancer spreads. It spreads locally to the lymph nodes, it spreads distantly to lungs and liver, etc. So जितना टाइम कैंसर को मिलेगा स्प्रेड होने के, उतने चांसेस है कि मेटास्टेसाइज करेगा, देन इट बिकम्स अ हायर स्टेज डिजीज विच इज़ वेरी डिफिकल्ट टू ट्रीट. थर्ड इज, जो आप इनिशियली ट्रीटमेंट देंगे दैट विल बी लेस एग्रेसिव, मतलब आपकी जो डोजेज होगी सपोज ड्रग्स की वो थोड़ी कम होगी, तो उसी की कॉन्सिक्वेंस में साइड इफेक्ट्स भी कम होंगे. एज विज़ जब आप लेट स्टेज में अग्रेसिवली ट्रीट करोगे, यू विल गिव हायर डोज ऑफ ड्रग्स, मल्टीपल ड्रग्स, तो साइड इफेक्ट्स वगैरह भी इंक्रीज हो जाएंगे. एंड लास्टली फ्रॉम द सिस्टम पॉइंट ऑफ व्यू अगर हम देखेंगे, अब आप ये देखिए कि कितना बर्डन है on the healthcare system. If it's picked up early, the burden lessens. The patient need not go for radiotherapy, need not go for other modalities. But same चीज़ अगर आप late pick करेंगे, he'll need additional modalities, he'll need radiotherapy, he'll need chemotherapy. So the system also gets compromised. So it is very important from all the aspects that cancer needs to be picked up early for better management and prognosis of the patient.
थैंक यू डॉक्टर फॉर सच अ डिटेल्ड एंड नाइस आंसर. सर, हम यहाँ पे एक मैम ने एक टर्म यूज़ करा, लेट पता लगना या एडवांस स्टेजेस. सो ये कैंसर के मामले में एडवांस स्टेज क्या होता है? व्हाट इज़ दैट वी आर सेइंग कि अब आपका कैंसर एडवांस स्टेज पे पहुँच चुका है?
देखिए, जो पेशेंट है ना जनरली कैंसर से नहीं मरता है। कैंसर जब मेटास्टाइज हो जाता है, मतलब जब पूरी बॉडी में फैल जाता है, जैसे मैडम ने बोला कि भाई अर्ली स्टेज में पता लग जाए, पेशेंट जब ट्यूमर लोकलाइज्ड है उसी समय उसी स्टेज पे हमको पता लग जाता है, जो पैथोलॉजी से और रेडियोलॉजिकल इमेजेस जो हैं ये बिल्कुल अर्ली स्टेज के अंदर हमको इन्फॉर्मेशन दे सकती हैं। तो उस स्टेज पे अगर पता लग जाए तो पेशेंट, जो कैंसर पेशेंट है, 100% ठीक हो जाते हैं। बहुत सारे एग्जाम्पल भी हैं, इसलिए कैंसर से डरने की ज़रूरत नहीं है, अवेयर होने की ज़रूरत है। अब जो एडवांस स्टेज है, जब वो कैंसर एक लोकलाइज स्टेज से होकर लिम्फ नोड में चला जाता है या दूसरे डिस्टेंट ऑर्गन में जब फैल जाता है, तो उस कंडीशन को हम बोलते हैं बहुत ज़्यादा एडवांस स्टेज, मेटास्टैटिक स्टेज। तो उस स्टेज में आने के बाद बहुत सारे कैंसर, इंडिया में क्या है कि मैडम 80-20 फार्मूला है कि हमारे यहाँ 80% पेशेंट लेट स्टेज में आते हैं, एडवांस स्टेज में आते हैं, इसलिए सिर्फ 20% पेशेंट को हम बचा सकते हैं। लेकिन वेस्टर्न कंट्री में उल्टा है, वहाँ पर 20% पेशेंट ही लेट स्टेज में आते हैं, 80% पेशेंट अर्ली स्टेज में आ जाते हैं, इसलिए वहाँ पे सर्वाइवल रेट ज़्यादा है। तो हम इस फार्मूले को रिवर्स करने की ज़रूरत है कि हमारी जो जनता है उनमें अगर अवेयरनेस जाए इस प्रोग्राम के थ्रू, तो वो अपने आप को अर्ली स्टेज में डिटेक्ट कर लें और इमीडिएटली क्लिनिशियंस का परामर्श लें, तो उनकी लाइफ को हम सेव कर सकते हैं।
राइट। प्रोफेसर, एक टर्म और आता है फॉल्स नेगेटिव, उसका क्या मतलब है इसके अंदर?
हाँ, फॉल्स नेगेटिव मतलब बेसिकली हम टेक्निकल टर्म यूज करते हैं। जब मान लो किसी पेशेंट, कोई पेशेंट है वो क्लिनिक में आता है और उसको डिजीज है, लेकिन समहाउ ड्यू टू सम रीजन उसकी वो क्लिनिक जो उसकी डिजीज है वो डिटेक्ट नहीं हो पाती है और रिपोर्ट में नॉर्मल रिपोर्ट आ जाती है, तो हम उसको फॉल्स नेगेटिव बोलते हैं। एक्चुअल में डिजीज होती है, लेकिन ड्यू टू सम रीजन कहीं भी टेक्निकल प्रोसीजर्स हैं और वहाँ पर कोई गलती आ जाए कि पेशेंट सब्जेक्ट इज़ नॉर्मल। अब पेशेंट तो बिल्कुल अपने आप को नॉर्मल समझेगा, रिपोर्ट सही आ गई है, लेकिन कैंसर जैसी बीमारी जो है इंटरनली वो बढ़नी शुरू हो जाती है, तो इससे काफ़ी नुकसान हो सकता है पेशेंट को।
थैंक यू प्रोफेसर। मैम, इसी के लिए आई बिलीव कि हम अर्ली डिटेक्ट कर पाए, इसीलिए हमारा iOncology.ai प्लेटफॉर्म बना है। सो मैं आपसे उसके बारे में पूछना चाहूँगी कि iOncology प्लेटफॉर्म जो है वो एग्जैक्टली क्या इनिशिएटिव है और उससे हमें क्या फ़ायदा हो रहा है?
तो iOncology प्लेटफॉर्म जो है, जो 4 पिलर्स हमने डिस्कस किए, उस पिलर्स को वो इंटीग्रेट करता है। सो इट इज़ एन India-centric AI solution, a platform which enables you to develop models. To start with, we have taken ovarian cancer and breast cancer because these are the more prevalent kind of cancers. So like sir said, we have models designed for screening, we have models designed for diagnosis, for treatment, for monitoring. So these are the steps that a patient goes through when he comes to a doctor. So ये steps कितनी हम जल्दी कर सकें. So early diagnosis की जो आप बात कर रहे हैं, तो इस हर प्रोसेस में there is a delay, a time delay. तो आपने पहले वीडियो में देखा कि डॉक्टर के ऊपर कितना लोड है, पेशेंट का लोड जो हॉस्पिटल में है वो कितना है, रिसोर्स कंस्ट्रेंड जिसको हम कहते हैं. सो दैट इज़ व्हाट is the reality of our nation today. So if we have AI driven solutions, then doctor is able to augment his skills with AI. Right. So I like to call artificial intelligence as augmented intelligence. So human intelligence is the one which is driving the AI tools. So even in this platform, a very important role is played by doctor when he annotates the data sets. So annotation का मतलब ये है कि that you give the ground truth to the model which is to be developed. Then model experts बनाते हैं, but उसके बाद before it is deployed, we need to do what is called as validation. So unless the model is validated, the doctors will not get the confidence to use those models. So अगर आप देखेंगे तो हर step में the human intelligence is the one which is being used to create that model. So it is nothing but a mathematical expression of the data that it sees. So जैसे ह्यूमन बीइंग लर्न करता है, उसी तरह से ये मॉडल भी लर्न करता है. When over the years lot of data is being collected. Right. So when the doctor annotates that data, which means what he's doing is he's putting his intelligence. Annotation is nothing but the doctor's intelligence in the data. And when the model actually learns, what it does is it looks at the patterns that the doctor has given and converts that into a mathematical process, which helps us to, when a new data comes, then what we do is model inferencing. So the trained model is used to infer the results which a doctor could have given based on the training that it undergoes.
Ma'am, you said it's India-centric. By that we mean it has been created in India, or it is only for Indians? What do we mean by it?
Yeah, so that's a very good question actually. So what India-centric actually means is at the level of hardware, it is designed at C-DAC. So the Param Erawat system, which is used to create the models, is designed in India. Then the second layer is the software layer. The software layer is also designed by experts at C-DAC. And the third layer is a very important data layer. So our experts who have come here on the panel today, they have helped us create that data. And the last layer is the layer of validation that is also being done on Indian data sets. So data sets are Indian, hardware is Indian, software is also Indian. So that is why it is India-centric. And like sir also said, why India-centric? Is it used only for Indians? Not necessarily, because oncology by itself is kind of global. So what is special about India is the patterns that we see in this country. So like sir was giving the example of Assam or giving the example of Maharashtra. So the patterns that different states see, the occurrence of cancer, different types of cancer is varied across different states. So the intent is to be able to give more specialized solutions based on the geography, based on the demography, based on the age group, based on the profession. So these mixes are very different in our country. So this flavor forms part of that model.
Right.
So it is used more for the, so it is in that sense India-centric.
One more thing I want to add. This iOncology.ai was developed by for Indian scientists, for Indian doctor and Indian patient. When I say Indian patient, because you see huge crowd in the hospital, our doctor get very less time to see the patient. But what are the characteristics when patient come in the OPD? So during this project we make it, we sit with our clinicians, medical oncologists, surgical oncologists, pathologists, molecular oncologist, everyone. They give even radiologist. So they give their inputs to what are the characteristics when patient come, they take care of. So all these characteristics we put in the Excel sheets. We noted that characteristics, multiple stage, different clinicians of AIMS. I'm thankful for our clinicians of the AIMS because it's a team project. So they approved it, and accordingly retrospective and prospective data we choose and we enter in that software. Then C-DAC will work on that, convert into the algorithms. So this is the Indian patient by the Indian scientist for Indian doctors. So that is more Indian centric.
So indigenous.
Yeah.
Thank you, Professor. Professor, I'll also like to understand that how is this platform supporting the doctors during diagnosis? क्या अर्ली वार्निंग साइंस के मिस होने के चांसेस कम हो गए हैं?
यस, देखिए नंबर एक तो ये जो सॉफ्टवेयर भी यूज हो रहा है रिसर्च मोड में यूज हो रहा है, नॉट ओपनली यूज्ड, सम लिमिटेड लैब्स एंड हॉस्पिटल्स. हियर क्या होता है, जैसे आप देखते हो कि जब एक रिपोर्ट आप दिखाते हो, जनरली जब प्राइवेट में लोग दिखाते हैं तो एम्स में ज़रूर आते हैं दिखाने के सेकंड कंसल्टेशन के लिए. तो कई बार गलती से कभी मिस हो सकता है कि भाई काफ़ी बड़ा छोटा सा फॉर एग्जांपल कोई ट्यूमर है तो एक अलग अलग पैथोलॉजिस्ट का या अलग अलग रेडियोलॉजिस्ट का अपना व्यू हो सकता है. बट इन AIML thousands of imaging data, both pathological and radiological image, collectively we trained the models. तो वहाँ गलती से भी गलती होने की जो संभावना है वो कम हो जाती है ना, तो वो पिक कर लेता है. तो इन दैट वे it helped the clinician to detect the tumor very early stage, and accordingly it assists the clinician to take a better treatment plan.
Wow, thank you, Professor. Dr. Fauzia, the platform has been specially designed for breast and ovarian cancer initially. यही वाले cancers पहले क्यों लिए गए?
This is a good question. See, breast cancer is the leading cause of death. It's the leading cancer in women in India at this point of time. at least roughly around 27% of female cancers are attributed to breast cancer. So it's the leading cause. It has surpassed cervical cancer, which was the leading cancer earlier on. Now breast cancer is the main cause. So that's one reason. Secondly, ovarian cancer is maybe a little less, but around 6 to 7% of all female cancers. But it has a caveat that it has very vague presenting features. Like for example, breast will present with a lump which can be detected if the patient is aware and goes to the doctor early. But ovarian cancers, they usually present at a late stage because there are no specific signs and symptoms for it. There are vague presentations which can be of any other disease also. So, and it's a very, I mean, if not treated at the right time, it's a very aggressive cancer. So that is why in the female population, these two cancers are a major public health problem. And that is why in iOncology, these two cancers were selected because of their high public health impact.
Thank you, ma'am.
If I would like to add
Yes,
also,
please.
The development of models is also driven by the data sets that are available. So these are also, since they are more prevalent, the data sets are also available. The annotated data sets are available. So it is not sufficient to have raw data. The explanation from the doctor's side, which is referred to as annotation, is available for these data sets, for these kinds of cancers.
Ovarian cancer called cancer or whisper cancer or silent killer also, as madam suggested. So both these cancers are very dangerous for the woman, and women are the center pillar of every family. So that is reason, as Prime Minister Sahab also saying that कि हमें अपना मातृत्व का ध्यान रखना चाहिए. So that is another intention to take this cancer in the front line.
थैंक यू प्रोफेसर. मैम, अब कुछ डेटा हम बात कर रहे हैं. डेटा स्पेसिफिक मैं आपसे क्वेश्चंस पूछना चाहूँगी कि दिस प्लेटफॉर्म यूजेस अ वेरी लार्ज डेटा ऑफ मेडिकल इमेजेस. व्हाई इज अ लार्ज क्वालिटी डेटा सो इम्पोर्टेंट?
Yeah, so actually when we talk about AI, there are a variety of AI that are techniques that can be utilized. One is machine learning, the other is deep learning. Then we also have generative AI, and now the latest is the agentic AI. So different modalities of AI require different amounts of data. So if we use machine learning models, then the data size requirements is lower. The processing power also required is lower. If we go for deep learning models, which are required for both radiology as well as pathology modalities, then the data size requirement also goes up. The processing power requirement also goes up. So it is defined also by not just the amount of data, but also the quality of data. So both these aspects are interdependent and related to each other.
सो मैम, व्हेन यू से रेडियोलॉजी, पैथोलॉजी, तो इनके लिए जो डेटा आता है वो डेटा भी अलग अलग तरीके का होता है, अलग अलग टाइप का डेटा फिट इन किया जाता है, या एक बार आपने डेटा डाल दिया, द प्लेटफॉर्म कैन डिसइंटीग्रेट इटसेल्फ एंड यूज इट वेयर एवर इट इज वांट?
No, so हर data modality के लिए variety of different kinds of models need to be built. So MRI data हो सकता है, CT का data हो सकता है, X-ray का data हो सकता है, mammogram data हो सकता है. So if it is diagnosis, the data is different. If it's screening, the data is different. For pathology, we have got histopathology slides. So depending on the kind of data, we have to fit the right AI model to create the right, we call it like, one size fit all is not available. So it is, we are in an era of what is called as narrow intelligence. So we develop problem specific AI models. So that is the requirement.
That is reason we put the iOncology AI is integrated. So we integrate all type of data in one platform.
Okay. फौजिया मैम, मैं आपसे पूछना चाहूँगी, हमने इंडिया सेंट्रिक की बात करी थी. Why is India specific data important in this?
See, whatever, we have large number of databases available at this time, like TCGA, and there are many other TA. But we lack in a data library, a data set, a robust data set, which is confined to Indian population, because there are many diseases and variations and genetic changes which are specific to the region. So we need to, so suppose we are training the model on a data set which is a Western data set. And then ultimately we have to validate it on we have to use it on our own population.
Yes.
So that is, I don't remember exactly what the term is, that when there is a discrepancy in the validation and the input learning module. But so you need to have an algorithm in place which will recognize the indigenous data set. So that is why we want to collect data from our indigenous cohorts, and make it robust, so that when we eventually test it and use it in the practice, it is able to deliver the outcome.
Yeah. Thank you.
So I would like to add here
Yes,
also
please.
that the model that we build is as intelligent as the data that you feed to it. So
Okay.
if you expect that the model should recognize ovarian cancer, we should feed it ovarian cancer. If you feel that the data should work, the model should work on Indian data sets, then naturally you have to insert Indian data sets.
Okay.
Because that is also the reason why we call it as augmented intelligence. So if the model has not seen that kind of data, then it would not have learned that pattern. So it is important that we design it for Indian data sets.
थैंक यू मैम. सर आपने पहले कुछ देर पहले मेंशन करा था कि अभी ये रिसर्च मोड पे है, बट कहीं कहीं ये लगाया जा चुका है, तो उस जगह से डॉक्टर्स का कैसा रिस्पॉन्स है, कैसे हेल्प कर रहा है ये उनको?
They are very wonderful response from there. They are very they are very satisfied, and because as I suggested, this is on the research mode. We get lot of inputs from them. Accordingly, our C-DAC team, we are together working on that to further, because it's technology every time need to evolve. So उनको जैसे एक तो इलेक्ट्रॉनिक हेल्थ रिकॉर्ड मेंटेन करने में काफ़ी हेल्प कर रहा है, पेशेंट्स को रूटीन में जो उनको अपॉइंटमेंट देना है, दैट इज़ द वेरी बेसिक थिंग्स विच दे आर वेरी अप्रिशिएटेड. अलॉन्ग विद दैट, लाइक सम पैथोलॉजिकल रिपोर्ट, आप रेडियोलॉजिकल इमेज, उनको डायग्नोज करने में काफ़ी हेल्प कर रहा है. अलॉन्ग विद दैट, दिस सॉफ्टवेयर आल्सो हैज एनोटेटिव टूल्स. अगर iOncology कुछ रिपोर्ट को गलत भी बताता है, क्योंकि ये एट प्रेजेंट अराउंड 79% एक्यूरेसी वी गॉट इट फ्रॉम दिस सॉफ्टवेयर. सो क्लिनिशियन हैव द एक्सेस टू करेक्ट इट द रिपोर्ट. ओके, सो इन दैट वे दिस सॉफ्टवेयर अगेन लर्न इट, ट्रेन इट. So in that, so basically, like as a research mode, they are very satisfied, and along with that, we are still improving this software to make it more better.
तो सर अभी तक जो यूसेज हुआ है, क्या कभी उसमें कोई ऐसा मोमेंट आया जिसके अंदर क्लिनिशियन ही सरप्राइज हो गया हो कि ये किस टाइप का डायग्नोसिस आया है, या क्या मतलब पोटेंशियल कुछ आया है?
एक दो केस ऐसे आए नॉलेज में, जैसे कि बाहर से कई बार रिपोर्ट्स आती हैं तो कोई कंफ्यूजन रहता है कि वेदर व्हाट इज दैट. तो इन दैट केस iOncology help to take a decision.
Okay, all right.
And if I can add, there are a lot of side effects of this project also. So side effects ऐसे होते हैं कि it excites a lot of doctors. So everybody today, they are wanting to see something live. तो मतलब literature review या paper presentations या conferences में सुनना अलग है, और रियलिटी में एक लाइव सॉफ्टवेयर देखना अलग है. सो इन कंटिन्यूएशन ऑफ दिस प्रोजेक्ट, CMC Vellore also got interested with this idea, and we also have an oral cancer related projects with CMC Vellore. So ऐसे side effects इसके अच्छे मिलते हैं हमें, and we are able to proliferate the excitement around AI. आपने कुछ दिन पहले अभिषेक सिंह सर के साथ भी ये पॉडकास्ट किया था, and he had made it very clear that AI is not just generative AI. He had made a very, very succinct and important point. And that was around AI being a lot of things which are more useful and practical. And it has an impact. So the AI Summit also was centered around impact. So this is one solution which is having the ability to show that impact, showcase that impact for the doctors.
Due to interest of the doctor, a lot of people are contact us. We need to deploy that one. So we are under the process to deploy different aims and different other institutes. But we are every time get declared we are under the research mode. We are going to deploy that software.
I'd like to add something here, that at ICMR Center for Cancer Pathology, we are now planning to establish a digital pathology archive, which will include all the organ systems and images from all the organ systems and from various cancers, and make a library, make a data set which can then be utilized by any researcher. So that process is underway. So like it's once you do one project, you know, it leads on to another, and it's a self-propagating movement then.
Right. So doctor, मेरा अगला सवाल भी आपसे यही था कि that do we require any new kind of data and more data of whatever data is available to make the system smarter?
So we will be adding, you know, we'll be adding other, like we're just adding the data for breast and ovarian cancer.
Right.
So the next phase would be obviously including other, you know, cancers of public health importance and other cancers. And secondly, then in addition to, you know, just diagnosis and all that, we would also like to add the molecular, you know, data from the molecular tests,
Right.
mutational tests and other specialized investigations wherever they are available. So that when you integrate all these, this is called as multiomics.
Right,
So when you have pathology, you have radiology, you have molecular data and other such kind of data, high throughput. So it's a multi-omic approach towards a disease. So that is the future.
Thank you, doctor. Professor, मैं आपसे क्योंकि आप एम्स से हैं, so एम्स जैसे हॉस्पिटल में इतना ज़्यादा पेशेंट्स का लोड रहता है, ऐसे में ये iOncology प्लेटफॉर्म कैसे ये लोड कम करने में हेल्प कर सकता है, स्पेशली फॉर द गवर्नमेंट हॉस्पिटल्स?
जैसे कि बताया ना कि जब पेशेंट लोड ज़्यादा है हमारे क्लिनिशियंस के पास, दे हैव वेरी लेस टाइम टू सी द पेशेंट. सो एक तो सिस्टम को स्ट्रीमलाइन करने में हेल्प कर सकता है ये. दूसरा डिसीजन टेकिंग, जो क्लिनिशियन डिसीजन लेते हैं अपना, जब एक ओपीडी में जब क्लिनिशियन बैठा है, ही गेट ऑल द डेटा इन सामने उनके डेस्कटॉप पे आ जाता है. सो व्हाट इज दे फॉलो अप में इट हेल्प कि व्हाट व्हेन पेशेंट कम एंड दे गिव द ट्रीटमेंट, तो व्हाट इज द प्रोग्रेस ऑफ द डिजीज और व्हाट इज द इफेक्ट ऑफ द ड्रग. ही विल गेट ऑल द डेटा अबाउट देयर लेबोरेटरी टेस्ट, क्लिनिकल लेबोरेटरी टेस्ट, पैथोलॉजिकल रिपोर्ट्स, आपका रेडियोलॉजिकल इमेजेस and molecular data. So in molecular data we try to make this iOncology.ai more smarter by integrating the molecular data as Dr. Fozia suggested. So once everything in the one place, clinician get it, so it reduces the time and it increase the efficacy of the clinician. Basically iOncology.ai is a assisting software. He assisting very well. So in that way, time per patient is reduced, so ultimately help to manage the crowd.
So I would like to add also
Sure.
that the next step towards this, and which Dr. Ashok has been after me, that अगला phase लिखिए मैडम, इसको हमें आगे लेके जाना है. So the next phase is, since we have all this variety of data, it leads to the next level of AI, which is called as the digital twin.
Yeah.
Okay.
So a human twin is created in the form of software. So, and before you can actually give treatment to the patient, you can analyze the effect that the treatment is going to have on that patient.
Right.
So this is the next higher level of dream that sir is urging us to take this direction.
Basically that digital twin helps to give the precision treatment.
Right.
अभी तक हम बात करते पर्सनलाइज ट्रीटमेंट की, बिकॉज नाउ लॉट ऑफ लिटरेचर कम, इंस्टेड ऑफ कैंसर स्पेसिफिक वी give the treatment gene specific. So what are the genes and epigenomes are changed in the particular patient? Accordingly, digital twins help to design a better treatment protocol and assisting the clinician in future.
Right. थैंक यू प्रोफेसर. मैम मैं आपके पास वापस आती हूँ कि जैसे ICMR और एम्स और सबके इतने सारे सेंटर्स अक्रॉस हमारे कंट्री हैं, इन स्मॉलर डिस्ट्रिक्ट्स ऑल्सो, what is your view that इस टाइप का जो प्लेटफॉर्म है, how can it help the people in the smaller districts and the far away lands? Is it possible for the doctors over there to be equipped enough to use a platform like this? What is the status?
Definitely. So that is the whole idea, that this platform will be utilized. See, we don't have a problem in the big urban cities. There are multiple centers and doctors. This is actually for the people at the grassroots level. So I'll give an example. If there is a small district hospital and the doctor there needs some second opinion, so he can use this platform. Secondly, if there is some place, a pathology lab, which just doesn't have these ancillary techniques, so they just have to upload the images of the case.
Right.
And at the centralized, wherever there is a centralized center that can assist them with all those diagnoses and other ancillary tests which can be deployed by AI now, instead of actually doing it on the tissue. So it can have that, like we have a concept of telepathology. You project the slides and the diagnosis is made from somewhere else, like you have telemedicine. So now people are even operating, they're sitting in one country and operating in another country. So that is the basic concept at the district level, at the smaller, in remote areas. This has a potential to help with the patient management and treatment.
Thank you, doctor. So,
one additional point to this
yes,
is
ma'am.
Also that it enables what is called as work from home for doctors. So this is something which was highly appreciated when I visited AIMS CMC Vellore conference. So all the doctors really thought that earlier times only IT professionals could work from home, but now with this technology we are enabling doctors, radiologists, pathologists.
So ma'am, मैं आपसे बोलना चाहूँगी कि if any doctors from the rural India or across, apart from Delhi, are watching this show, how can they reach out to you so that they can use this iOncology platform for themselves into practice?
Yeah, so what we advise in this case is this solution currently is designed for AIMS New Delhi. So different varieties of hospitals, small hospitals may have different requirements, medium level hospitals may have different requirements, and top tier hospitals like AIMS will have different requirements. So depending on the kind of data that they have, we have to design different solutions for them. This is one part. The second is like Madam Fauzia also mentioned, that the data sets that are available with that hospital will help us to design solutions for that hospital, because healthcare is a very strategic sector, and the data is not so shareable as of today. So there are different policies that are applicable to those hospitals. So based on the data policies of that hospital and based on the resources that are available at that hospital, we will need to design solutions.
All right.
So we can reach out to me or you can reach out to Dr. Sharma. We are more than happy to guide people who want to embark on this journey.
Wonderful. So friends, I would like to tell you that if you have any queries which come up after the program, you are most welcome to write to us. We will ensure that your query passes on to our experts. Thank you. I would like to tell you also, like while we were speaking, I didn't realize the time. We have a lot of comments on our YouTube chat. So I'll try to take them up and let's answer viewer queries. The first one is from Voice of Youth P3V. Who gets cancer? Is cancer genetic? And as discussed, almost more than 60 cases of cancer reached hospital in the last stage. Can you please tell the initial symptoms of cancer?
So that is true, that early detection, as we said, we emphasize on that. So there are certain telltale signs for various cancers. Every cancer will have some particular signs and symptoms. If we take a breast cancer, for breast cancer, a breast lump is the most important presenting feature, or discharge from the nipple, bloody discharge from the nipple. For example, if you have lung cancer, then persistent cough and coughing up blood with your cough, that is also one of the signs. So similarly, different cancers have different presenting features. Oral cancers, they will present with an ulcer in the mouth. So the moment you see that there is something abnormal in your any system, it's best to consult an expert. It's best to consult the doctor. Nowadays, what we see is that people treat themselves because of all these, platforms which are now available to us. We recently had a case where a man was treating his father for 4 or 5 months on his own. He had got something from a chat GPT. He had got this entire medicine plan from chat GPT, and when he finally, his symptoms persisted and he came to the clinic, he had cancer lung. And he was being treated for, some kind of respiratory illness by the son himself. But it was too late by that time. So it's very important to recognize these signs and symptoms. And one thing I would like to mention here for the women and, with context of breast cancer, breast self-examination. It is a very easy method. I mean, we all see reels pertaining to anything in the world. We can see a video of self-breast examination. And if we follow it monthly or bi-monthly or something like that, you can, many a times you can pick up a lump. And it's easy to do. And these are the certain things which you have to be aware of and then present to the expert.
Yes.
I want to request all your audience, साल में एक बार तो ज़रूर अपना ब्लड टेस्ट कराएं, जिससे कि अगर ज़रा सा भी abnormality आती है तो प्लीज़ सेल्फ मेडिकेशन ना करें, अपने क्लिनिशियंस को जाके ज़रूर कंसल्ट करें. दूसरा 9 to 18 ईयर ओल्ड गर्ल्स जितनी भी हैं, जैसे मैडम ने बताया ब्रेस्ट कैंसर के लिए सर्वाइकल कैंसर की वैक्सीन्स अवेलेबल हैं. जैसे कोविड की 3 डोज हमको लगी, ऐसे ही सर्वाइकल कैंसर के लिए 3 डोज लगती हैं. और अच्छे गायनोकोलॉजिस्ट या मेडिकल ऑन्कोलॉजिस्ट से आप कंसल्ट कर सकते हैं. 3 डोज देने के बाद मोर देन 19.99% हम बच्चियों को सर्वाइकल कैंसर से बचा सकते हैं.
थैंक यू प्रोफेसर. आई होप लोग आपकी बात आज सुनेंगे और मैं भी पूरा ट्राई करूंगी कि ये बात ज़्यादा से ज़्यादा लोगों तक पहुंचे. अगला सवाल आया है आकाश शर्मा जी से. Looking ahead, how do you envision the future of AI in transforming cancer care and preventive healthcare in India? Ma'am.
Sure. So actually, we have just embarked on this journey.
Right.
And in terms of usage of AI, like we discussed earlier also, it is important that we collect data, it's important that we annotate data, and it's important that we create the cancer-specific modality-specific models.
Right.
And we validate those models. So a very good example has been set up by iOncology in terms of collaboration. So I would urge that medical experts, AI experts, they collaborate.
Right.
So that's a very key ingredient of taking AI forward in an impactful manner.
Right.
So this example of iOncology is also that of a collaboration. The second example is also that of transformation. So data set ऐसे ही पड़े हुए आज हमारे पास. Are we really utilizing the power of those data sets? So data is now called as a new oil. आपने सुना होगा.
Right.
कि जितना आपके पास डेटा है उतने आप rich हैं. या उतने आप data rich हैं, ज्ञान rich हैं. So this knowledge richness, and like she also mentioned that in the rural areas we are not able to consult, even the doctors are not able to consult with each other. मतलब कुछ case आ जाती है तो it is imperative that you discuss among your colleagues. So AI is that tool which will bridge this gap, and it actually includes the intelligence of so many hundreds of doctors. So this is the way forward. We are also blessed because we have this Ayush line of treatment. So if we augment the Ayush line of treatment with this our regular treatment for cancer, then definitely as a nation we have a very good way forward. The second last important point also is that in the area of preventive care, because that is what the question I think also intended. So this knowledge gap which is happening today, where we discuss that बहुत लोगों को पता ही नहीं है कि self examination करना है. So even for that we have got tools like iCare at home. So these are patient-centric tools. So variety of tools are required. So based on the type of problem that we have, if we have a doctor's problem, then iOncology is the solution. If we have patient-centric problem, then iCare at home is the solution. Right. So it is important that we use different kinds of solutions based on the kind of problem at hand.
Right.
So don't just try to use technology for the sake of it. Look at the problem first.
Right.
And then that will give you the direction for the right AI solution to design.
Thank you for your message, ma'am.
Thank you.
The next question is from Brinda Gupta. How can AI improve accessibility to cancer screening in underserved regions? So, ma'am.
Can you please repeat
Sure.
the question?
How can AI improve accessibility to cancer screening in undeserved regions? The underserved regions.
Brinda, that's a good question, and that is one of the pillars of this AI in healthcare. So as I said earlier also, I mentioned that screening for all cancers is not possible everywhere in the country. It's a tedious job and having screening clinics and all. But if you have certain modalities in place, for example, I'll give you an example that oral cancers. Now, there was a project a few years back wherein they just decided that if we take pictures of those oral cancers and send it to with a simple smartphone and send it to the centralized lab, and therein they will decide, they will just triage it. They will not say that whether it is, which kind of cancer it is or not, but just that by using the AI algorithms, you triage those images into suspicious, benign or malignant. So if you triage them, you kind of identify those cases which need further investigation, and then you send them to higher centers. So that is one way which it can be used. Then second thing is screening is one more in cervical cancer is, for example, done by pap smears, vaginal smears. And they are like very time consuming. Seeing vaginal smears is very time consuming, and if there is a good volume of them, it takes plenty of expertise, it takes plenty of time. By AI, you can reduce that time and accuracy to more than half. So in West, AI tools are now extensively used for, they have done away with screening people for vaginal smears, and only AI models are used in so many centers now. Similarly, that's what we can do here, is that we can triage the cases to begin with, reduce the time and the manpower and other costs, and thus that can lead to early detection also of those cases.
Thank you. I would also like to add here for the benefit of Vrinda that unlike the Western countries, our mix of population is such that the doctors are very few compared to the large number of patients that we have. So this is the ideal tool for augmenting the efforts of the doctors and for reaching out to the rural population. And like she said, I would like to also add that there's also an extension of WhatsApp that has been created that can be utilized to access these solutions which are available. So extensions can be created as per use. So if larger hospitals require only API kind of services, then APIs can be provided. If hospitals in rural areas where definitely network is available today, we can be connected through WhatsApp. So for them, the WhatsApp extensions can be provided to this same solution. So solution can be made accessible to different areas depending on their need.
Thank you, ma'am. The next question is from Kanika Kuthial. Hello, myself Dr. Kanika. My question is, can AI genuinely reduce the cost of cancer diagnosis and treatment in India, or might it widen the gap between high and low resource settings? Professor, ma'am.
तो cost का ऐसा है अभी at this point that the models that are developed are definitely requiring GPUs for processing. So processing cost today is around the GPUs, certainly. तो अभी to start with, जैसे इसका usage बढ़ेगा, वैसे the cost for processing will reduce. So जितना हम उस super computer को जितना हम load करेंगे, जितना वो ज़्यादा results हमें देगा, उतना उसकी cost कम होगी. So that we realize that the cost of computers, which was more than ₹1 lakh 20 years ago. Today in that same 1 lakh you get much better processors, you get much higher processing power at your speed, at your beck and call. So you can do lot more today than you could do long back. So cost benefit analysis इस तरह से हमें करना होगा. So the more adaptability increases, the more take up of these technologies will happen, and hence the cost will go down.
Second thing, like cost in another way, like that when patient come in the advanced stage, so treatment is very costly. It need to stay more time in the hospital, as Dr. Fojian starting said that. So iOncology software will help to detect the cancer very early stage. So in that way, treatment cost is also less, and hospital cost is also less. So in that way, we save the money and resources of the country also.
Thank you, Professor. Another question is from Preeti Gupta. Does AI helps in post-treatment of cancer also? Or maybe this platform?
Yeah, iOncology, we are designing like in such a way that after the treatment we also like survival, how long they are going to survive and quality of life. Such kind of parameter we are still working on that. So on the basis of that, the doctor when give the treatment, what is their impact and how long it survive and how long is the quality of life. So this parameter we are still working on iOncology.ai.
But very, very important question.
Yeah, I'd like to add here that many of the, as Madam would agree, so risk prediction models, that is one aspect of AI. So those will initially only at the time of diagnosis only they will predict how that a patient will behave. They will predict. So that is also another important point, that whether the prognosis will be good, survival will be more, and what kind of tailored therapy is required. So that risk prediction models are also important.
Another question is from Vinod Yadavji. If the AI flags someone as high risk of cancer, how is that communicated to the patient without causing unnecessary anxiety or panic? These are for the doctors.
No, see, what I say, जो पब्लिक है वो कैंसर के नाम से ही डरती है. एक स्टिग्मा बना हुआ है कि कैंसर हो गया, पता नहीं क्या हो गया. अगर हमारी पब्लिक की, जनता के माइंड से ये डर निकल जाए तो आप कैंसर से वैसे ही बच सकते हो. यू नो कैंसर जो सो फंटास्टिक डिजीज, ऐसी बीमारी कहाँ मिली. आप ही बताइए, बीपी का इलाज होता है क्या?
नहीं, मैनेज होता है.
मैनेज होता है. आपका डायबिटीज मैनेज होता है, थायराइड मैनेज होता है, कैंसर मैनेज होता है, ट्रीट होता है. कैंसर से लोग ठीक होते हैं. 60% कैंसर ऐसा है जिससे आप प्रिवेंशन ले सकते हो. 40% टबैको रिलेटेड, 20% इन्फेक्शस रिलेटेड. अगर आप टबैको का सेवन किसी भी फॉर्म में ना करें तो आप 40% कैंसर से बच सकते हो. 20% जो मैंने बताया 9 ईयर्स से लेके 18 ईयर्स तक जो गर्ल्स हैं उनको अगर HPV की वैक्सीन लग जाए, जैसे हमारी कंट्री पोलियो फ्री हो गई है, ऐसे हम HPV फ्री भी हो जाएंगे. तो 60% कैंसर से तो प्रिवेंशन है. और आपका प्रोस्टेट कैंसर है या आपका टेस्टिकुलर कैंसर है, 100% सर्वाइवल है. बट कैंसर की एक ही शर्त है कि वो ये कि आपको अर्ली डिटेक्ट कराना पड़ेगा, टाइम से डिटेक्ट कराना पड़ेगा. अपने कंसल्टेंट डॉक्टर के पास जाना होगा जिससे टाइम पे आपका इलाज स्टार्ट हो सके.
क्या ऐड करना चाहूँगी मैं, तो यादव जी को ऐसे मैं आश्वस्त करना चाहती हूँ कि AI डायरेक्टली पेशेंट के साथ डील नहीं करता. सो द AI इज डीलिंग एक्चुअली विद द डॉक्टर. सो जो कंपैशन का पार्ट है, तो दिस क्वेश्चन इज मोर टुवर्ड्स द कंपैशन एस्पेक्ट. So that compassion still has to be done by the doctor, and what AI has assisted the doctor is AI has given him more time to show that compassion which is required in dealing with giving this news. So I think that question was related to
expert people use, not common people. This software.
Correct. Keshav Garg is asking, can this platform be integrated with hospital information system?
ऑलरेडी इंटीग्रेटेड है. उसमें पूरा आपका लेबोरेटरी डेटा और जो भी आपका इलेक्ट्रॉनिक हेल्थ रिकॉर्ड है वो सारा iOncology में ऑलरेडी इंटीग्रेटेड है.
समय का अभाव होने के कारण मैं लास्ट का एक क्वेश्चन और ले लेती हूँ. प्रीति जी पूछ रही हैं दैट मेनी टाइम्स वी सी दैट डिफरेंट लैब्स शोज डिफरेंट टेस्ट रिजल्ट्स. कैन AI हेल्प इन दिस आल्सो?
Yes, that is the reason AI developed. Because every lab have the different reports, different pathologies have the different opinion, but this iOncology.ai have the data of all the multiple pathologists, radiologists, clinicians come to one point, and it analyze and learn, and then final report he will suggest it. And final decision has been taken by the treating clinicians. Overall power with the clinicians. It is just a assisting software helping the radiologist, pathologist and clinicians who give the treatment.
इसमें एक पार्ट जोड़ना चाहूँगी मैं. जो एक मॉडल हम जब बनाते हैं तो इट इज़ नॉट अ सैक्रोसैंक्ट मॉडल. सो वी कीप आइटरेटिवली ट्रेनिंग इट. सो इफ़ द डॉक्टर फील्स टुडे दैट जो AI ने रिजल्ट दिया है वो सही नहीं है, it needs to be something else, then there is a feedback loop. So ये feedback loop हम मॉडल ट्रेनिंग को देते हैं, और जैसे डेटा ऐड होगा, जैसे वैलिडेशन ऐड होगा, वैसे ये फीडबैक नेक्स्ट साइकिल ऑफ आइटरेटिव मॉडल डेवलपमेंट में जाता है. सो इट टेक्स इनटू अकाउंट दिस इज द प्रोसेस ऑफ वैलिडेशन. सो द वैलिडेशन feels that AI has not given a right result, then there is a mechanism which is kept specially for the doctor, and that is the reason why sir said that this is in the research mode. That is the reason this needs to be in research mode for some time, and till the pathologist or till the radiologist gains enough confidence on the AI, we will not start giving results.
Right.
So it's an iterative process of building AI models which keep improving over time.
Right. Thank you, ma'am. Dr. Fauzia, in your view, in your experience, do you feel these kind of models, like iOncology is one, so these kind of AI models can help in early detection of other diseases also than cancer?
Yes, definitely. There are many models in place already. I mean, not in the iOncology, but in otherwise also, and later on they can be incorporated. For example, in cardiac diseases.
Right.
So there are models which have been developed to see the ECGs and echo findings, and predict earlier which patients will, say for example, go into heart failure or arrhythmias. So those models are already developed. And secondly, in conditions like neurodegenerative disorders, when we talk of Alzheimer's disease, we talk of other multiple sclerosis and other neurodegenerative, Parkinsonism. In those diseases, taking the EEG data, taking the molecular data and other clinical parameters into account, there are many models which have which can predict which patients will actually go into full-fledged Parkinsonism or full-fledged Alzheimer's. So they can do a prediction. There are prediction models. Similarly, for diabetes, for example, there are wearables which are now very much in they are all AI assisted. So how much insulin has to be given to the patient, it's happening in real time. So it's not just cancer, restricted to cancer, it has potential in other disease processes also.
So ma'am, my last question to you, or rather I'll request you, what's your message to the current pathologists or the people who are trying to become pathologists, that they should not be scared of AI, rather they should adopt AI? What is your message to them?
Definitely. See, the notion that AI is going to replace a doctor, a pathologist or a radiologist is not there. It will be a useful adjunct. It will be a useful assist, and eventually it is the doctor who makes the ultimate decision in majority of the cases. There are certain cases where you can totally leave it to the AI platforms, but in most of the cases, gaining all this information from AI assisted tools and other modalities, then you make an integrated decision, and that is the final outcome which is given. But having said this is something which is the future, and we have to adopt it in some form or the other down the line. And it definitely needs a lot of infrastructure and other things, but it's doable, and I hope, as ma'am said, with time the cost will go down, and every doctor and every pathologist and a radiologist should have awareness of artificial intelligence.
Thank you, doctor.
So I would like to add to madam
yes,
that
ma'am.
this is the tip of the iceberg. Abhi to shuruaat hai.
Right.
So we started as a lone effort, and people have started joining. और इसका कारवा कब बन जाएगा is what we are dreaming for, hoping for.
So मैम, यही मैं आपसे पूछना चाह रही थी कि as a technologist, so टेक्नोलॉजी की दुनिया में लोग इसको बड़ा ही स्कैरी से देख रहे हैं. So the technologist in the healthcare side, what is your message to them कि how should they look at AI in healthcare?
So a very important thing for technologists is to collaborate with the doctors. So this I think I'm repeating multiple times because I have two of my very close collaborators here on board today. So this is a very big message that we want to give. That technologists usually they sit all by themselves and they just look at Google and try to make some models. So that's not the way forward. The way forward to create impactful solutions is to collaborate with doctors. And like she said, the more you collaborate, the more innovative solutions will come out. Right. So, क्या AI ये भी कर सकता है? क्या वो भी कर सकता है? क्या वो भी कर सकता है? This kind of excitement gets generated in the doctor. And the interns that come to me, that I make it a point to tell them that don't just sit on your desk to create AI solutions. Right. Make sure that you talk with the domain experts, show your solution to the domain experts, get their view, get their validation, then only you proceed with development of that model. Don't create technology for the sake of technology.
21st century is the century for the AI and machine learning. हम कितना ही कोशिश करें इससे बच नहीं सकते हैं, है ना? तो क्योंकि मेडिकल साइंस इज अ कॉम्प्रिहेंसिव and our clinicians are the end users, and any technology which is developed by us for our clinicians, because they are the main key person who translate the knowledge to the or give the translational workflow to the patient. We are not treating the patient, we are a technology development person, we are assisting the doctors. So that technology not replacing a doctor, it strengthens the doctor further to serve the society.
Thank you, Professor. I thank all three of you very much for your insights, for your views, and sharing your experiences with us. Today we have spoken about a very, a crucial topic, the cancer diagnosis in India and how we are using AI in it. So thank you so much. Thank you for responding to our queries. And my heartfelt thanks to our viewers जिन्होंने अपने questions हमसे किए और हमें भी प्लेटफॉर्म के बारे में और ज़्यादा से ज़्यादा जानने का, AI इन हेल्थ केयर के बारे में जानने का और ज़्यादा से ज़्यादा मौका दिया. So मैं आप सभी को तहे दिल से धन्यवाद देना चाहूँगी. My dear viewers, if you found this conversation helpful, अगर आपको लगता है कि आज की हमारी बातचीत किसी डॉक्टर की, किसी रिसर्चर की, किसी पेशेंट की, किसी फैमिली की हेल्प कर सकती है इन एनी वे, सो मैं आपसे रिक्वेस्ट करूंगी कि आप इस शो का जो लिंक है जिस पे आप ये शो देख रहे हैं वो ज़रूर उनके साथ शेयर करिए. और उनसे भी दरखास्त करूंगी जो ये लिंक को बाद में देखेंगे, शो को बाद में देखेंगे, कि आपकी कोई भी क्वेरी है, कुछ भी आप पूछना चाहते हैं, सो यू कैन रीच आउट टू अस on our official email ID, which is askarexperts.negd@digitalindia.gov.in. ये ईमेल आईडी आपके साथ नीचे स्क्रीन पे भी लिखा हुआ आ रहा है. अगर आप डिजिटल इंडिया के किसी और इनिशिएटिव के बारे में जानना चाहते हैं या हमारे पुराने एपिसोड्स, जैसे कि मैंने बताया आज हम 47th एपिसोड पे हैं, हमारे और एपिसोड्स को देखना चाहते हैं, सो आप हमारे वेबसाइट digitalindia.gov.in या negd.gov.in जिनके द्वारा ये कार्यक्रम प्रस्तुत किया जाता है, आप उनकी वेबसाइट पे जा सकते हैं, आप हमारे पुराने एपिसोड्स देख सकते हैं और ये वाला एपिसोड भी हमेशा उसके ऊपर बरकरार रहेगा. सो योर टिप्स एंड ट्रिक्स फॉर एंड इफ यू वांट टू हियर टू द एक्सपर्ट्स ऑन ऑन्कोलॉजी, देन यू आर मोस्ट वेलकम टू वॉच दिस एपिसोड अगेन. सो अब वक्त है मैं डिजिटल इंडिया क्वेश्चन निंजाज के नाम अनाउंस करूंगी. सो आज के हमारे डिजिटल इंडिया क्वेश्चन निंजा हैं वृंदा गुप्ता, Preeti and Kanika Kuthial, Dr. Kanika Kuthial. I congratulate all of you for winning the Digital India Question Ninja Reward. I request you to kindly share your details on our official email ID, askarexperts.negd@digitalindia.gov.in. आपको अपने डिटेल्स में अपना क्वेश्चन जो आपने पूछा था, जिस नाम से आपने पूछा था और आपका एड्रेस जहां आप अपना रिवॉर्ड डिलीवर करवाना चाहते हैं और आपका फ़ोन नंबर हमें ईमेल पे भेजिए, हमारी टीम आपको ज़रूर रीच आउट करेगी. सो दोस्तों, सीखते रहिए और हमारा शो ऐसे ही देखते रहिए. तब तक के लिए मैं आपकी होस्ट शिप्रा इब्राहिम अपने एक्सपर्ट्स के साथ आपसे विदा लेती हूँ. अगले हफ्ते फिर मिलते हैं एक नए टॉपिक के साथ. नमस्कार.